Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, I'm super excited about my two girls that I have on today, Eunice and Courtney. I'm going to let them introduce themselves. Go ahead, ladies.
I'll go first.
Courtney.
My name is Courtney. I'm also known as Chicago Massage. Hey guys. I've been a massage therapist for about 18 years at this point. I have a spa background. Most currently, for the past about 8 to 9 years, I've been doing post-op care here in Chicago. I'm fully mobile, so I come directly to you. You do not have to go anywhere because I know you can't drive anyway, but I literally bring everything. I walk you through day 0 all the way into, we're doing some maintenance, we're doing some body contouring. So I love you. I love your booty. I love your babies. I love your puppies and your kitties. Yeah, that's me.
I love it.
And pet pigs.
And oh my God, yes.
And
your pet pigs. I have a client that has a pig. Amazing. This is my bestie, Uni. I've known her since.
I'm gonna talk.
Okay, she's gonna talk.
We go way back.
The band.
to marching band guys. As wool suits and pompadour hats. Anyway, so I'm Eunice and I am here from Chicago. I've been a massage therapist for the last 10 years, 11 if you want to count school. But anyway, it depends on who you ask. And I have worked in a clinical setting for some time straight out of school. Okay, so I started off in a chiropractor's office treating various types of dysfunctions. And my passion with massage was always fascia or pain disturbances. And then later I had my own practice. I've worked in spa settings and I've been mobile for the last year and a half.
Yeah.
And so when I first started with post-op care, I started working in a plastic surgeon's office, working with their clients. And so that allowed me to kind of gain some experience in the post-op world. Right. And then I just loved it because it kind of helps me to develop all of my passions that I have, like for me, for you guys. So I love health. I love massage. I love relieving pain. I love postural dysfunctions and fixing them. I love trigger points. I love walking through everything. I'll tell you why your butt looks crooked. It has nothing maybe sometimes to do with the doctor's work. It could be your posture. And I just combine all of my experience to you guys' benefit, to my clients' benefit. Yeah. And I do actually like being mobile now. So that makes it way more convenient for you guys, way more discreet. And those first few weeks, as you know, a lot of you guys like to not sit for 6 weeks to 5 months.
Girl, 6 months. I had someone that didn't sit for 6 months.
Yeah. I don't know
How?
Girl.
I don't know. But the point is, we're mobile. We come to you and we offer all of the services. That's wood therapy. That's from day 1 to day 90 to maintenance. And we'll get into that later about how long you should be getting massages. Right. So
that's perfect. So now that you guys heard them introduce themselves, you'll understand why I thought it was such a value for them to come on. And let's tackle the subject that is probably talked about the most. Post-op care, massages. And if you've been on your journey and you've been researching, maybe you've already seen your consultation, you're thinking about post-op care, you might hear different opinions. Do you need a massage? Do you not need a massage? How long do you have to be in your garment? Some people don't get in a garment. Some people are only in a binder. And it's a lot of misinformation, a lot of confusion. And, with my podcast, what I want is to help women not be confused, make it as easy and as transparent as possible so that they can have an easy journey.
Right.
To a bigger booty or a
smaller waist.
Smaller waist.
Thing in your face.
Yes. Wet waist. What?
Well, you know what? Even if it's not booty, it might be face.
Yeah.
Let's talk about how important facial massage, facial
breast massage.
and breast massage. And pretty much if you've had any work done, you need to be getting some massage done.
Yes. So I tell this story at our workshop that's coming up July 10th, by the way. So get registered.
A few more spots left.
I got my breasts done in December. I massaged my breasts so much that my 4-year-old thought that when you take your shirt off, you automatically squeeze your boobs. And I had to tell her, no, mommy has to do that. Mommy has to do that. But, I have so many clients that get, any breast augmentation, a lift, an implant, whatever it may be, and they're afraid to touch themselves. And, you got to touch yourself,
And we'll get into that, but in more ways than
one in some cases, but they're your breasts. Please touch them, especially if you're getting an implant, because the implants are going to be up under your chin, right? So the massage helps them to fall. And I only see you once or twice a week. So, while I'm not there, you have to be massaging your breasts.
So you touched on the importance of facial massages. So I've found that I'm surprised that so many people really just kind of like suds their face. Because even if you actually get into washing your face and getting in the nooks and the crannies and all that, you're giving yourself a massage. Mm-hmm. And so lymphatic massage outside of post-op care is just as important. So if you think about preoperatively and postoperatively, they're equally as important for reducing inflammation, clearing out the skin, helping to aid and detoxify. It can help with wrinkles. It can help with a myriad of things. And so what I have found is that people who have maybe like a rhinoplasty, or we wouldn't really touch any fillers, but you would work in maybe surrounding or complementary areas. But those types of procedures generally will cause, of course, bruising and swelling in the face, but then or edema. But they will also sometimes the swelling can affect your nasal passages. Yep. They can affect your ability to breathe, and even swelling outside of a procedure for the face, the swelling, it will swell in your whole entire body. Mm-hmm. And so the importance of lymphatic massage, a true lymphatic massage is going to make you feel better overall. It's going to decrease the bruising. It's going to help maybe even clear out some sinuses and some allergy issues in a sense. It helps with BBL face, right? Yes. Which is what we call it, because people...
You're on your tummy, everything is coming forward. And when I see them, they're like, why is my face swollen? Well, you're swollen. So you're laying forward, everything is coming forward. So if you just got a BBL, everybody on Instagram, BBL face is not permanent. And give us some love, you guys. We're on live on everybody. Everybody send us some hearts. But BBL face is not permanent. That is for certain. What was I going to say? I can't recall what I was going to say. But yeah, that's one thing. When you have fluid in your body, fluid is going to go everywhere. And when I say fluid, I just mean inflammation and swelling. So I think when people say fluid, they mean, do I have a seroma?
Right. So when we say fluid and with lymphatic work, we're talking about like fluid dynamics within the body. So if you think of hey guys, thanks for the love. So we're talking about the fluid dynamic in your body. So when you have an excess of fluid or an excess of fluid, you tend to swell in general, right, with inflammation. And so you want to decrease that pre and post.
Yes.
So in your opinion, how many massages would a female who had, liposuction, tummy tuck, BBL, how many massages, how often would you recommend for them to have their massages?
You want to take this one?
I'll go.
Sometimes we talk over each other.
I know. And so we sometimes look at each other, or one of us will say pineapples. But anyway, I get this question a lot, and my answer is always at the very least 5. At least 5. Now, if you've come from the Dominican Republic and you've gotten a tummy tuck with your breasts and BBL
and thighs,
and thighs, and you got your teeth done, and then you got the O shot, and then you got, you're going to need more than 5, because Dominican dolls come back extremely inflamed because their regulations are a little bit different in the DR, and they're taking out a lot more fat than
what we can here
in the US. Yes, exactly. And so they're going to need way more than 5.
And combine that with the flight, because, then they come off the plane inflamed even more, just, due to the length of the flight and the travel and things of that nature.
Yeah.
So minimum 5.
Minimum.
But your typical recommendation?
I have clients that start at 5, and the end of our first visit, they said I need to book 5 more. So I think we both are in agreement that now we're just going to book 10. We're just going to recommend 10 because sometimes 5 is not enough. Sometimes your foundation was so amazing, you're good at 3 massages, because we're kind of looking like, what can we do here? You're great. Mm-hmm. Some people need a little bit more work than others.
There's many factors, just like there are how you're going to recover from surgery. There's age, right? Mm-hmm. Then there's the shape you were in before you had surgery.
If
how
you consistent eat fruit and
you
vegetables.
are after with your diet after. Were you an avid water drinker before? Mm-hmm. Do you wear your compression consistently? If I tell people, if you follow the rules that we give you and that, within reasonable expectations, then 10 massages, like in those first 2 months, should be sufficient. Mm-hmm. Now, if you're going to eat here, I know down there in Houston, they've got some nice tasty treats, but here in Chicago, if you're going to have a 6-piece with mild sauce, that's chicken wings with the special sauce.
And your gizzards fried hard.
Fried hard, because that's what you wanted. You're going to tend to swell more because those are inflammatory foods. Mm-hmm. And so you want to tweak your diet. Okay. You want to be patient and kind to yourself. You want to drink buttloads of water, copious amounts of water. You want to be hydrated. And you want to stay compressed. Mm-hmm. And then you have to also take into consideration how many procedures you had and how long were you actually under anesthesia, because anesthesia will also cause inflammation. Mm-hmm. And so a longer procedure, you're probably going to come out more inflamed than say something that's 3 hours.
Can we talk about the water situation though? I've had to explain several times to clients that if you do not drink water and you are already swollen, your body thinks that the water that is in you, that you're holding, you need it. Mm-hmm. So in order for your body to release that swelling, you have to drink water. If you've been my client, put it in the chat. Have I asked you, have you gone pee-pee? I'm always asking, are you going potty? Have you pooped today? I want to know how many times have you done that? If you're not drinking water, your body's going to tell me. People are always like, when is the swelling going to go away? How much water have you drank today? Eunice and I shared a client and she was telling me how she didn't drink water. I said, girl, you better drink that water before Eunice comes, because she's going to get on your case about it.
Me trying to clean up excess swelling without you drinking water is like the equivalent of, I don't want to say it's like throwing buckets of water out of a window, but it's the equivalent. It's just stupid work. And and honestly it is. And you're wasting your time, my time, and your money because you're not drinking water. And I will still give you the best care possible.
Exactly.
But if you would drink the water, you get way better, faster, more quick results in the healing process.
Can you tell me the difference between cavitation versus ultrasound cavitation? What is that? What's the difference?
So they're both very similar, and even radio frequency. They're all radio waves, right? They're at a different frequency. So let's say one moves like this, one moves slower, right? And the other one moves like way faster and higher, right? And so each one has a different wavelength. So that's how it is able to affect different areas of the body. Very similar to how imaging ultrasound is different than, say, therapeutic ultrasound, which is what you're referencing when you say ultrasound. So therapeutic ultrasound is designed to reduce inflammation. It is designed to help with pain. It is something that you use in physical therapy. It is something that you can use in a chiropractic setting. It generally is helpful with removing inflammation. It should be used at particular times. Again, this is why it's important to have a professional, because sometimes using ultrasound prematurely and ultrasound cavitation can be harmful to the body. Now, cavitation is designed, those wavelengths are designed to bounce off and to actually make fat cells kind of burst open. And then it allows, then the lymphatic system is going to reabsorb that fat and then eliminated. So we know fat cells really don't quite get removed except with lipo.
Right.
So they shrink. And so it bursts open and all that fat, gushy goodness, French fries and
Uni,
such.
may I add something though?
Absolutely. Pineapples.
If you have fluid and you are getting massages and they're giving you ultrasound, that is a big no-no. So just the FYI for everyone out there, if you do have a seroma, like I'm talking about a seroma, or you're still draining, you have fluid coming out of your incisions, you are not to be getting ultrasound.
Any kind of ultrasound.
Period. T.
Period.
The T. Period.
It may work sometimes, but it doesn't work.
It will harden.
All the time.
The fluid will harden.
You also shouldn't use it on really hard tissue either, or what's called ischemic tissue, or tissue that is lacking in blood flow.
I want you guys to give our listeners some tips to make sure that they're finding the right therapist, that they're finding the right person to do their post-op care. What are some things they should look for?
So I would say, do they have a website? Do they have, everyone's on Instagram, everyone, so do they have an Instagram? Are they posting their work? One thing I mentioned in our workshop is if I go to your Instagram, can I see what you do? I always am going to see my clients and they say, oh, I had a massage with so-and-so on Tuesday. And I'm like, oh, okay, cool. What's her Instagram? Because I like to support, I like to follow, I like to see what the girls are doing. And if I go to your Instagram and I see that you sell lace front wigs, it doesn't look like you do massage to me.
And not like you can't have more than one hustle, because we do.
Yeah,
I run them off now. But no, everything should be separate.
Everything should be separate. So, some of my clients know I'm a makeup artist as well. I clean up well, so don't look at me too hard. But I don't have my makeup on my massage account. I have my personal and my makeup account for that. So I should be able to go to your Instagram and see your work, because I want to know who else is out here in these Chicago streets, doing post-op care. So yeah, I like the social media, the website.
Yeah.
What else, Uni?
For us, word of mouth, to be honest with you, can be very positive, direct referral.
I like to recommend that for when they're looking for their surgeon too.
Yeah. Absolutely. And then you need to look at who's referring it, of course, but word of mouth, it makes a huge difference, especially when you have and for me, our good clients, they know when they follow directions and when they didn't. And so, they know. And so they make the referral accordingly. And most of the time when they make that adjustment, say, hey, what did you do? And they've already been telling their friends what they've been doing. So that makes a difference. And so when it comes time for surgery, so word of mouth is important. You can check, of course, pictures, right? You can check for credentials. And for instance, you can go on to the spa associations to check, right? For like body contouring, and we can get into that kind of thing, right? You can check for consistency. Okay. You can check for passion. Honestly, like outside of professional things, there are a lot of people right now in the post-op game getting in because they think the money is good. Yep. And there are people who who don't really have a passion for caring for someone.
They just want to make the money.
And I think that matters because, I went to school with a lot of massage therapists, and some are really great. Those were all my study buddies. Hey, y'all. Okay. And that's your crew. But there were people who graduated and they got the same education, right? But I don't know if they're as passionate. But now that post-op is like banging, you see so many people, and that's not a problem. That's what our workshops are for, so that you can understand where and what you need to do to be there for your client. Because it's not. I go to sleep thinking about you guys. Yes. I wake up thinking about, it's a very intertwined, committed type of situation. So those are things that you can look for. But of course, the website, Instagram, don't always get caught up in how many followers, because that doesn't always translate into quality.
It really does not translate. I know magnificent surgeons who have very small followings on social media that are excellent.
I would also say that when you're looking for a surgeon, Don't go to the one that has the K behind them at all, behind their number of followers at all times.
Mm-hmm.
One of my faves here in Chicago, he didn't have that many followers, but he's snatching the girls, like Miami. So now he's got that, that following because the girls have found him. But, find the diamonds in the rough. There are a lot of doctors here doing good work. And sometimes you find them when they're young and they're hungry, and you can get that good price. When they get a little bit more popular, that's when you're going to pay $15,000 for a BBL. So, but also in addition to what Eunice said, what did you say?
I was like,
you're right. We're going to pay it though. But in addition to what Eunice said, there are also a lot of good groups, not necessarily the surgery groups, but there are groups for lymphatic massage professionals that you can add yourself to. And there are directories that you can look for in different states. So I have had people hit me up, in my DM, like, hey, I'm in Bufu, Kentucky. Is there someone in my city? And I will actually look for them and try to find someone, because sometimes they are hard to find. And a lot of massage therapists are afraid of, they see you have a wound or whatever, and they're like, no, I'm cool. I don't do this. I've had some clients try to go to Massage Envy because they're desperate. That's a big no-no. So they will not take you at Massage Envy, or I believe you'll definitely have to sign like some waivers and stuff like that.
They do offer it, but we can get into that later. There's a difference between what is considered post-op massage or post-op care versus what is traditional lymphatic drainage massage or MLD and so with that being said, in some more, what are they called? Like chain type situations, they would probably err more on the side of a traditional
lymphatic,
manual lymphatic drainage. Yeah. And so you may not get exactly, you may get some help there. It may help, but it may not necessarily be the contouring type of massage that you're looking for.
When do you ladies suggest that they book their first appointment? After surgery, how soon to get massaged? And before they have their surgery, how far out are you booked?
This is like, we're like ready to pounce on this question.
You're like, go. No, just let her go first.
Okay. This is one of my biggest problems. Do not call me when you are stepping off of a plane asking, do I have any availability for the day? The answer is going to be no. Because I'm now booking about 6 weeks ahead of time. At this point, now I have people booking for November, for October. Someone tried to book for December. I am going to be out because I'm also having surgery of myself again. So I would say if you know that you're having surgery, you need to book your post-op care as soon as you get your surgery date. Now, I know that there are things that happen. Sometimes dates change. I tell people, look, as long as you're on my schedule, we can move that. But it is difficult for me to add you onto my schedule when you're coming home on Friday and today is Thursday. So please, as soon as you get your surgery date, at least for me, for my sanity, for my anxiety, please book 6 weeks or more ahead. One of the girls, I think she's actually still here watching. She's in September. I thanked her. Thank you for booking in advance because you saved my anxiety. Eunice and I talked about this once on our live. It really, because we think about you. We do. My inbox is full. We have a waiting list of people that we cannot even get to because our schedules, they're packed. And,
and it's only you. You only have two hands. Yeah. It's not, you can't hand it off.
So, even if we can't get to you, you're on my mind.
Yeah. So I'll call and be like, hey, are you out in Bensonville or something? She'll be like, no. I'm like, well, the lady she called, she was crying.
Right. She's in Bensonville. I'm like, girl. I'm
on the other side of the earth. Yeah. No, I tried. But honestly, it should be at least 2 to 3 months, 2 months minimum, 3 months. If your surgery date gets moved, that's fine. I would rather you try to be proactive.
Yes.
And being proactive and actually get you
you get more
in a sense, because well, we're not as stressed. Sometimes it's just easier to know where I'm going to be when I'm going to be there. And it also is a lot easier to set up the schedule that you may want of 2 to 3 times a week. If you book with me later and I happen to have a little bit of wiggle room, it may not be as consistent. Right. And so what the trend that has been lately is that a lot of ladies are booking with everybody. Mm-hmm. So they're like, I'm going to get 2 with you. I'm going to get 3 over here. And I'm going here. And then the truth of the matter is that now you're in frantic and panic mode, and so now you're going different places. And there's nothing wrong with that. There are some people who I love to work behind. Mm-hmm. some of our workshop attendees, but there are some people who I'm like, and
what did they do to you?
More confusion with the client as well, because so there's always more than one way to skin a cat, right? There's more than one way to do something. However, what my treatment protocol may not be complementary to someone else's treatment protocol. Not to say that their work won't work. There are some people out here not doing the thing, but let's just say but the people who are doing something, I would prefer either that we can talk, just like when I'm in the chiropractic world or in the clinical world, I usually would speak to whomever referred the client for massage so that I can actually understand what's going on, especially if they're under care of more than one person. Mm-hmm. And so being able to network with someone is equally as important, because with someone whom you're working with, because it's going to be more beneficial to the client. So I say book 2 to 3 months in advance for continuity of care.
With the same person, preferably.
Preferably.
Yeah.
I can tell you guys here in Houston, I'm very familiar and very close with the person who is doing all of Dr. Young Money's post-op massages and Dr. Patrick Shu and the Oaks Plastic Surgery. And she is booked out to October.
Mm-hmm. Yeah.
Like booked out every hour for 7 days a week. She told me the last time I talked to her. And so this is happening all over the country. Your post-op care providers are being booked out in advance. And
I think it's a lot of the COVID effects. Everyone is at home. And it's the perfect time to get your body done, and nobody will ever know. I mean, I am massaging a client and they're on a conference call. They're working. Their kid is in class. It's the perfect time to get your body done.
It really is. How long do you guys think they should wear their compression? I know in clinic, in practice, we always recommend 6 to 8 weeks. But I know there's women out there in a year in their faja.
Yeah. And after a year, I'm like, what is it really doing? Now having had a little bit of lipo, I got a breast augmentation and just a little bit of lipo on the side. I will tell you, I got like a faja bra. I understand now. I get it now. Eunice was telling me what to buy on Amazon. I was like, yeah. I didn't buy it.
We're the worst patients. We really are.
I snatched that bra off in the middle of the night. I told my doctor, I said, look, I gave you 7 days. I can't do it anymore. I understand how uncomfortable it is. However, I would get upset. I would throw it on the ground and then I would put it back on. Okay.
It's a struggle.
You got to have it on. It's a struggle. You got to find one that you like. You got to find one that is, I tell people at least have 2 or 3, depending on what you're wearing. Because a lot of people don't want to wear it because they look like a football player. They don't want to,
Yeah, I agree. And
if you don't wear it, you're going to feel
doctor. If it doesn't fit you perfectly, send it over to the faja doctor. She'll snatch it up. Yes.
Go see our girl Diana, the faja doctor. She's absolutely amazing. She will hook you up. Yeah, she's got she's got the game on lock in that arena.
She'll take care of it.
Doesn't matter where you are.
You
can mail it into her. She'll take care of it.
The faja doctor.
Call the doctor.
Yeah, call the doctor.
So 6 to 8 weeks is safe, Mommy. I do want to add to that, if that's okay. Most people wear compression at some point anyway. Like a lot of people before surgery. So I say in the faja, 6 to 8 weeks. But if you feel yourself swelling, if you feel like, you're out here binge drinking,
Put your faja on.
if you put it back on, don't throw it away. Don't throw away those phones. Don't throw away anything. Because you invested in it.
People throw away the phones.
They throw it away like, oh,
it was dirty. I didn't want it. Yeah.
Like, girl, you may need to spot compress. Now, some people will wear their faja or their waist trainer going further in, but you do still need to allow your body to work properly. 6 to 8 weeks is usually ideal. If it's done right, I tell you, if it's done right, your booty will be jiggling and, your waist won't be swelling up like that in 6 to 8 weeks. If you're not doing it right and if your eating's not right, something's not right, you'll be swelling.
Right.
You're eating,
And that is the major thing. That is the main thing. Your body is in recovery mode, y'all. Your body is in recovery mode. So literally anything that you're putting into your mouth, your body is going to react to. You're not drinking water, girl, you're going to be swollen.
You're eating a lot of salt.
I'm talking to you. I'm talking to you. If you're not drinking water, your body is going to hold on to the fluid and when I say fluid, I mean the edema, the water that's in your tissue. It's going to hold on to it because it thinks you need it. If you're drinking mixed drinks, that's sugar. In that mixed drink, that's inflammation. You're going to swell. You're going to be inflamed. I have a couple girls this weekend. It's their birthday. I said, okay, you get a little bit of a pass because it's your birthday, but I want you drinking water. And water is always the issue with people. And look, I'm the first to say, water is a problem for me too. I won't say a problem, but I'm not gonna. I drink my Starbucks before I drink my water. But I know that if I don't drink my water, I'm gonna be swollen. I knew I had to amp it up when before she saw me for my massages after my surgery.
Because y'all know how
before she got her hands on you.
Know how I feel about water. You're like, what did you do to yourself? You're thirsty, aren't you? Did you have water today? And they'll be like, one bottle. One bottle. It's 4 o'clock. What's wrong with you? I have one bottle at 3 a.m. You got to wake up for surgery. How is she going to get all that water in? And something that's funny is most people don't realize that most of the time when you're hungry, you're thirsty.
Yeah.
You're mainly thirsty.
And so, y'all, you invest in this. It's a lifestyle change. Surgery is a lifestyle change. If you're not willing to understand that, then surgery is not for you, period. So
now we did get someone in the chat. She said she was told 6 months. I mean, that's correct. But I also say my answer to a lot of people is listen to your body. People say, how many massages do you think I need? And, you could say, Courtney, you know what? I've had 5. I think I'm okay. And some people don't want to let me go. Some people don't want to let Eunice go. So it's just depending on what your body is telling you. If you try to go out of your faja half the day after your 6-week mark and you're like, I can't do it, then hey, put it back on.
Put it back on.
So let's say this. If you went and had surgery and you did a total Mighty Morphin Power Ranger body morph, okay, so meaning that you had maybe 2 to 3 rounds of surgery, the results of 2 rounds of surgery in one surgery, you may be in your faja longer because your it's going to take longer for you to recover. Again, it's all, there's no set rule, but there's great guidance. 6 to 8 weeks is generally good. Sometimes Dominican dolls do live in their fajas for a while, and that's usually because of the nature of the procedure and how it was done, right? So,
and that's not to say I don't want any of our listeners to get confused and think that 6 to 8 weeks is just how long their swelling is going to last, because your swelling can last up to a year.
Yep. Off and on. Yep.
And you'll feel it. If you eat bad over the weekend, even if you're 6 months post-op, you'll feel it. You'll see it. Put your faja back on.
Don't forget to put the faja back on.
Right. Don't forget.
Okay. You out here partying. Don't. Jay-Z said it. Put it back on. So I have a question here about drinking liquor. I don't know if we were going to.
So I know we recommend for our patients no drinking up to 8 weeks. No drinking at all. No alcohol. No. You try to stay away from sodas. Try to stay away from any sugary drinks, high calorie drinks. Kind of just stay away from it. drink your water.
Yep.
Alcohol is going to help you swell, and I don't want to be swollen.
Swell hell.
Swell hell. So it happens every time. Also because people plan surgery
around their
and
birthday.
Then they think, they want to be snatched for a trip. They want to be snatched for their birthday. And that's all great. I love it. But you're not going to be able to celebrate in the same way. The celebration is the body. So what happens is you go on a trip and then like people try to get in a massage before they go on their trip. And I'm like, that's cool, girl. But look, you really should be trying to get in when you get back. You be like, let me get in before.
So what am I doing? What am I doing?
Who, you?
Yes.
What are you doing?
We celebrating and then we go, I'm having my surgery.
I have surgery the week after her birthday, but see, that's a whole nother thing. I tell people, so I just had this conversation with a client, was still speaking about alcohol. She's like, well, she's going to a wedding and she's going down south, right? Down there where you are, where the food is delicious. And, and she's like, well, I'm like, so I know you're going to drink. And then they were trying to get her to, step out of her friends, peer pressure. She's like, girl, you don't need that for a few hours. We all know. And she was forward thinking enough to know that an hour is not going to be enough. Like she's going to be out of that faja for hours. And then she might combine that with a little salty food and combine that with liquor, at least more liquor than water. And it's a recipe for swell hell. Okay. So it's just it's not worth it, honestly. So if you're really, really wanting to get snatched, like for your birthday, you should do it like 3 to 6 months before your birthday. Then at 6 months, then maybe you can step out, have a drink, and then chase it with some beet juice.
You and your beet juice. Okay, side story for everyone. So I'm over at Uni's house, and I'm like, oh, girl, what we drinking now? She got the bottle, she got the glass, and she's like, oh, girl, this is beet juice. I'm like, beet juice in my Soulja Boy voice.
Like, girl, where's the wine? I was like, that's beet juice.
I'm like, beet juice.
Like, yeah.
I would like the beet juice. I don't drink anymore.
Yeah.
I stopped drinking completely. So now the beet juice sounds really good.
Have you? Yeah. I mean,
I've had beet juice. I like it.
Beet juice, lemonade, beet juice, orange juice, beet juice, apple juice. Fresh beets. They're messy though. I just get the,
Yeah, because they stain everything, right?
They can.
Yeah.
Yeah, but
let me tell you guys, when I say we're the worst patients, I know I'm a terrible patient. Because let me tell you my swell hell that I myself caused, knowing I shouldn't have done it. So maybe a week after my surgery, I had a breast reduction and I had a little bit of lipo. I decided to go to a music festival.
A week later?
A week later.
Oh, girl.
Maybe 7. It was probably maybe 10 days later. And I wore my faja up until my festival outfit. And then I took it off. It was when I still drank alcohol. So
it was hot outside? Was it hot?
And it was hot. And then it got cold at night.
Girl.
I was terribly swollen to the point where I was like, I can't even put my garment back on. Like it was so bad. It took weeks. It probably took 4 massages to get all of that swelling back to where I was right before it. So don't be me. Don't be a Mavi.
No.
Yes. Don't do it. I actually watched someone's stomach swell, like rising bread. We were on a cruise and they're like, I'm not wearing this faja. And I was like, okay, I ain't working. And because I'm on vacation. So don't look at me and stuff. You just party. The stomach's just. I was like, okay. And the rum. And I was like, girl, what you gonna do about that? Because I'm on vacation.
Right.
No, I'm just kidding. But I warned you, at least put a waist trainer on for something. You can't,
Okay, tell me, you guys. I know massages aren't supposed to hurt. How come I hear from so many patients that they hurt terribly, that they can't handle it? I know when I had my post-op massages, my massages did not hurt at all.
Okay.
What's going on?
People handle pain differently. And I would say it should not hurt, but it's not going to be the most pleasant, especially day 1 through 7. I think Eunice, you saw me day 3, and I was calling you all type of names. It's not the most pleasant. I tell people to breathe through it because deep breathing also helps me. It helps your lymphatic system, helps you kind of calm down. It is not going to be pleasant. However, if you can just get through it, give me as much time as you can, you're going to feel so much better when you step off the table. For my tummy tuck girls, you're going to be walking a little bit straighter. BBL girl, you're going to definitely feel the difference you're going to see and feel the difference when you stand up. So I wouldn't say hurt per se, but definitely uncomfortable. But a lot of people handle pain differently.
So there's a lot to that. Of course, it's going to be someone's personal pressure. Everyone's pressure is different.
Mm-hmm.
So again, something that is traditional, like just straight manual lymphatic drainage may not be as painful, because I've had people come to me and say, they're all anxious, right? And then when it's over, they're like, "Oh my God!" And they would book me just because it didn't hurt, because on YouTube and they say it would hurt. And then I have some ladies now where I'm finding that I'm lighter with touch, and they're like, "Ah, oh, ah, oh, oh."
Mm-hmm.
Okay, so I'm like, wait a minute now,
right?
Mixed feedback. Then there's also a variation in technique where you are in the procedure, how often you took your pain medicine. Are you hydrated? Did you take your faja off an hour before I got there? Are you beginning to swell despite my best efforts due to that? Did you eat well? How aggressive was it? The surgery? There's various, and then some people just don't take pain well. And then also there's some people who think it's supposed to hurt. And honestly, I've found that it's not a visual thing, but it's like a club getting surgery. So some people are like, "Ooh, it hurts." And I've had some people where I was doing something, I'm like, "This doesn't hurt." And they're like, "No." And they went to this transcendental state. So it just, I think, varies, right? On some people. Most of the time it shouldn't really hurt. It will probably be uncomfortable. You should feel better afterwards, and you should urinate a lot afterwards. Yes. Otherwise, it may not have been an effective session. And I think also that there's various techniques that people employ. As we talked about before, there's no one way to skin a kitty cat, right? So in some instances, there are people who are applying more pressure at times. I'm not going to say that it's wrong or right. You shouldn't feel like you shouldn't be.
This should not be a deep tissue massage.
Right. It's not a deep tissue massage. Exactly. Then also I found that a lot of people, their first massage is after surgery. And so some people have a first professional massage, I'll say. So some people don't really know what
it should feel like.
For me, deep tissue, some people hate deep tissue because
it's too deep.
They say it hurts.
Too hurtful.
But if it's done correctly, trigger point therapy is the best thing that ever happened to you. But so it just depends. But it should not be that painful. No, but it may be uncomfortable.
Okay.
To Eunice's point, when she mentioned the doctor, I've had the same client get multiple rounds, and the first round, they were in no pain whatsoever. I saw her the very next day. She had no fluid coming out of incisions. She was talking and we were laughing. We're chatting. She had another round with a different doctor. It was totally different story. I could barely touch her. So the aggressiveness of the doctor makes a huge difference in your pain level. How you've prepared preoperatively does, make a difference. Everything that Eunice said, but definitely I can speak to the doctor and their aggressiveness. That's going to have a huge bearing on how you feeling. That's for sure.
Okay. My next question is kind of a touchy one, I think, in the
we like it.
Faja burn.
Ooh.
What's your opinion on Faja burn? So I don't know if you listened to my episode with the Faja doctor, but I was telling her that, I didn't see Faja burn before. Not often. It was not very often that you would see it. And even now, I don't see it. I didn't see it that often in clinic, but I see it more online. And I want to know what y'all think about it. Do you think it's from the faja? Do you think it's from overly aggressive lipo? Do you think it's a combination?
Sometimes it can be a combo. I've seen some really ugly faja burns. Those are real. Those are really, really real. Yeah, that's perfect. Those are really real. Usually the ones that I have seen you see them more at the waist, the smallest part of the waist. Get closer to me. So we see those a lot. We see them in the waist, the tummy area. Sometimes people are compressing too much too soon. And we warn about that, especially in the beginning, because you're numb, right? So you can't feel the pressure of the garment and the ab board and the foam that you put in your 4 days post-op. That's unnecessary and you can't feel it. So we've seen some ugly stuff, but lipoburn doesn't appear until like a week post-op.
It really depends because, this is where we're trying to get more regulation and consistency. Some doctors will tell you not to wear an undershirt.
Mm-hmm.
Some doctors will tell you to wear an undershirt. Some doctors say do this, do that. Some people don't want to wear them. Some wear foams directly on the skin. It's all going to be contingent upon the quality of the skin. And so I've had to explain to people even further along, they'll ask, are we going to do this treatment or this treatment? And say, if your skin isn't ready,
mm-hmm.
then I can't do it. And so oftentimes people do not prepare their skin pre-surgery. Like they're just worried about after surgery.
Mm-hmm.
Well, have you been drinking water? Have you been eating your vegetables? Have you been having your beets? Because beets increase circulation.
Mm-hmm.
Have you been exfoliating before? Have you done your normal leg work? Because if you did, your skin would be in a better shape to take some abrasions, right? And then so I think back to when first time I breastfed my oldest daughter, I was so afraid of having chapped nipples that I was getting it in without it. Okay, I'm in there, right? I'm prepping, I'm priming because I'm that sounds painful, right?
Mm-hmm.
Chapped just from nursing didn't have a problem, right? So I'm just a big fan of doing everything that you can.
Doing the legwork.
Yes.
Yeah. So then if you take that out of there, then you have the undershirt. And so some people say no, but in traditional, for bandaging and for post-op bandaging, you would use a cotton base to protect the skin because the skin is compromised, right? So you wouldn't put that foam piece right on the skin because the skin is compromised. It mm-hmm. needs a barrier. There's moisture issues. The foam, there's lots of reasons why you could be getting quote unquote faja burn. You could be put in the wrong faja. Yep. I have a client now who was put in a side zip faja. Mm-hmm. And I don't even know why they still make those.
I hate those.
But that's another situation because they just wrinkle up on one side yep. and cause an abrasion for mm-hmm. no reason. For no reason.
So you look good on one side, but the other side you're gonna have a bulge, and it's gonna look like this because of that damn zipper.
That side, I hate that side.
I hate it.
Get rid of it.
Get rid of it. Throw it away.
I know the faja burn is maybe caused by the faja, maybe it's a combination of things that causes it. It's not just the faja.
I'm telling you guys, I didn't see it often before.
Yeah.
I didn't see it often. And the practices that I worked in were, top practices and they were aggressive, but I guess not to the point where we would see anything like that. Lipo burn or faja burn.
Yeah. Also, I noticed we talked about this in our class. Not to talk about with plastic surgery being so readily available to everyone. I have no problem with junk food. I have no problem with all those. But there are people who may they would in the past you would be denied cosmetic surgery if you were not a good candidate. Mm-hmm. But there are so many people now who may not in the past have been candidates. You know what I'm saying? Mm-hmm. And then basically they're having plastic surgery. And
I think the thing is now that they have the opportunity to go out of the country, and now it's more readily available out of the country. If they get a denial here in the US, they just go somewhere else.
Yep. They go right to the DR.
Mm-hmm. I've seen it.
Yeah.
I've seen it in person with patients who have seen me mm-hmm. and I've turned them down, and then I see them because they follow me on Instagram. I'll see them now, 6 months later and they have a completely new body, and it's because they went down to the DR.
Mommy, I just had a thought when I think about it, because most ladies, when they go to the DR, they're down there for somewhere between 10 days. And this is in no way a slam on the DR, but just take all these things into consideration, right? That they're down there for 10 days and they're washing with baby wipes, right? They're usually in such bad shape. They're probably not really moisturizing their skin. And as we just, figured out, they may not even have been good candidates here and they went there. So maybe skin wasn't a top priority, or health, or whatever the factors are why they were denied surgery here. You know what I'm saying? Those factors contribute to your skin being that it's the largest organ in the body. And so if you take all those things into consideration, I have had people who come back from the Dominican and I'm like, and then they use cavitation and ultrasound devices down there sooner. Mm-hmm. And then they come back looking like, hot dogs in the microwave. Yep. Like they come back with nuked skin. And it's upsetting, but you have to do your own work. There's nothing wrong with going to the Dominican, but you just better prep, prime. I mean, it depends on who you ask and what doctors. There are a lot of practices, but I personally will stay in the States.
My personal preference is always going to be to do what's safest. And I will always advocate to do whatever is the safest. And the safest would be to stay in your home country and have your procedure where you can recover, where you can readily see your physician if you have a complication and you're not having to call and, try to figure out if you have an infection and now who's going to take care of you. Now you have extra cost that could have been avoided.
Yes. And I always, we talked about this as well. We have clients that go to certain places and you have a complication and you go to the emergency room. They're going to say, oh, you had surgery where? Yeah, here's a Tylenol. So they're not going to take you. It's a liability issue at this point.
I've seen it.
Yeah. Mm-hmm. Yeah. We've
seen it. I've had patients come in from out of the country with wounds, large wounds that they cannot get to close. And it's been like 6 months and they've just been trying to care for it at home. And now they're finally, in our emergency room calling the plastic surgeons that are on call, trying to figure out how is this patient going to be taken care of? You can almost fit your fist in her abdomen. And those are the complications that a lot of patients don't know. The hospitals here, we see complications from out of town surgeries. We see, BBL infections. We see abdomens that are opening up full of infection that have to be reopened and, cleaned and debrided,
drained and
redone,
debrided.
And when you're on your plastic surgery journey, make sure that you're doing your homework, and please take every single factor into consideration. I know you might feel like this is the safest,
and not necessarily the cost. I'm sorry, Mavi, but some people it's just the cost. They're like, oh, I can get all this done for $3,500. That's where I'm going. Sometimes it's $3,500 for a reason. So if it's my body and it's my life,
Well, I just thought if I'm gonna spend $3,500 there, then everyone thinks differently, right? If here's let's say here's maybe $12,000, but you could go here for $3,500. You're gonna spend about $5,000. I would say saving $3,000 is a win. So then book your massages before. So then take care of yourself before. Get some pre-op massages before. You know what I'm saying? Buy some organic food a few months before. You got a pregame for these things. If you're going to take something, if you're going to be risky, you have to do as much. And there are some people who come back from the Dominican, they look beautiful and they're great and they're thriving. But there are some people who go, and unfortunately, because of the price, you see various types of complications because the price is cheap and the not to say the quality is low, but when the price is cheap on something and it's over,
they're overbooked.
Overbooked. No way. Yeah, I was going to use an economy situation there, but basically, when the demand is high, the supply is high, the cost generally goes, lower, except for capitalism. But anyway,
You're giving us a lesson here.
But no, usually the quality may be compromised. So it's just something to look out for.
I tell my patients, you guys, be honest with yourself. Be honest with yourself. Are you healthy? Are you struggling with diabetes? Do you have high blood pressure? These are, if you were turned down here in the States because of health issues or your BMI was too high, they're turning you down for a reason, and it's safety. It's a safety reason. So, that price might be attractive. And if you're healthy, young, vibrant, okay, do your research, do your homework, make sure you're doing all the right steps. But if you are, older, your health is not perfect and you're overweight, I personally would not take those chances to travel out of the country with, risk factors.
I have someone here who says, they agree at the Real Miss Smith. She said, my girl paid $2,500. They didn't perform tests or anything. She had blood pressure issues and all that, but they didn't care. And so,
that's crazy.
Yeah. I know. And we had an episode, I believe the financing episode, where we were talking about, okay, you want to have this done. You've decided you want to get some body work. Now, how are you going to pay for it? That's where I had our care credit rep come talk to us. Let's see. I want to help. If women don't know that they can afford financing or they can get financing, we went over requirements. They have interest free.
Yeah.
It's safer. That's my opinion.
Exactly.
Stay
Sorry,
here.
there are fireworks in the background.
We all know it's almost July 4th. And we're on the Indiana border here.
I'm so glad you guys came on with me today. I think we talked about a lot of really good stuff.
We did.
And do you guys want to tell us about your workshop?
Yeah.
I will let Courtney go.
No, I talk too much. You says I talk too much.
We have our second workshop, and it will be July 10th. And
we're excited.
We're excited. It's basically Post-Op 101. And we teach you the basics, the fundamentals. It is for allied healthcare providers. Okay. Those are individuals who are looking to possibly segue into a post-op career. And it's all the information that we kind of had to put together on our own, plus some solid research given to you guys in a nice bundle. And this will be we're adding to it, but it's a great class. And we got positive feedback last time. And I think we have a few more spots left.
We do. We have a few more. We kind of keep it minimal just because I guess it's still COVID season, but we keep it minimal so it could be super interactive. We have a lot of fun, a lot of good discussions. We go off script all day long.
I think that happens.
It's a lot of fun. So July 10th, we're going to be there's a neighborhood in Chicago called Bronzeville. Super cute. We have a really beautiful gravestone that we got. So we can't wait for our attendees to come, and it's going to be dope.
Yeah. Well, you know what? We go off script, but the stories are what's really real, because you learn so much from
real life
stories. Not
and
just
I have plenty
information thrown at you. I think that's the part that people value the most about the workshop, because
that's great. And I'm so happy and I'm so proud of you guys.
Thank you.
This is innovative. I know the Faja doctor and I have talked about it. Now, you guys, this post-op care niche is growing. And I'm so glad that there's professionals who have been in the game for a long time, willing to teach those younger providers who are just trying, they're hungry.
Yeah.
And they're just trying to get in there, and they're trying to help, and they're trying to figure it out. And this is perfect.
Thank you. I love your platform.
Thank you.
Yeah.
Anytime, reach out to me. Y'all want to talk about something? Let's talk about it.
Yes,
what I want is
always.
One
day we should do an episode where we talk about just crazy stories, crazy post-op stories.
Oh my God.
People that we meet
so
and stuff
many.
like that.
Maybe we should do one in October, for Halloween.
Oh,
yes. That sounds great.
Tales from the booty side.
Yes.
Let's plan for that. A Halloween special. Tell us about your booty.
Your booty.
Booty.
I'm dead. I am dead.
Sorry for your mom joke.
I got it. That's what I wanted. Anyways, you guys, I didn't talk to y'all about Bruce Juice.
Yes.
Eunice and Courtney know about it, but it's still, this is my sample. I haven't,
We need
it's
it.
not out to market yet, but Bruce Juice is the product that I formulated to help your bruising and swelling go down after surgery. So my product will be in Courtney and Eunice's hands here soon.
Yeah.
And they're going to give us their feedback, and I can't wait for you guys to hear it.
Yes, I can't wait.
I've had a few patients who have been trying it for me, and she is post-op day 5 and her bruising is almost completely gone.
Wow. Okay.
Where she's been applying. So she applied and she didn't apply in her some parts, and she applied in other parts, and you can see a difference where she applied and where she didn't apply. Because for her, she's like, I want to be in a bathing suit in 6 weeks and I want to get this, done. So I can't wait for you guys to have this in your hands and give me your feedback. Try it on your clients.
Get it.
Wait. Love it. I can't wait.
All right. That's it, you guys. Thank you, Courtney and Eunice, for coming on with me. I can't wait for our October episode. It's going to be epic.
Yes.
And fun. I can't wait. I know the patients like to hear the horror stories.
Oh my God, all the time.
Mm-hmm. The good, the bad, the ugly. Maybe we'll wear a costume. I don't know.
Hey, I like the costume idea.
Yeah. Bobby, it's been a slice. I can't wait to see you again.
All right. We'll see you guys next week.
Bye.
Bye. I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.